Hello again, good afternoon. This is the third round session to meet the innovator, in this case, Expert 3D. Expert 3D is one of the programs of our education portfolio. For those that haven't met me before, my name is Montse Delgado. I'm the education manager in EIT Health Spain, the innovation hub that EIT Health has based in Barcelona. And I have the pleasure to have with me the co-leaders of this educational service. They are Josep Munuera. Josep, allow me to read. Josep is the head of the Diagnostic Imaging Department at the Innovation, Research and Quality area at Sant Joan de Déu, the Children's Hospital of Barcelona. Welcome, Josep. And then we also have his colleague at the same hospital, Arnau Valls. Arnau is at the research and development team of the same hospital, but he's also in charge of the 3D planning area of this hospital. Welcome, Arnau. Happy to have you both here with us today to share this experience, this exciting experience with us. And one of the reasons why we decided to highlight your experience was because it was very much a needs-driven story. So the reason why we are here is because you experienced firsthand the need for this educational offering, and it was not existing in the market in that moment. When more recently we explored the market, now you started having some competitions, but it was 2 years after. And nowadays you are sharing this very exciting, in my opinion, journey with a few partners, a number of partners around Europe. From the industrial perspective, for example, we have Philips, but we have up to 5 sites within this educational project. You are collaborating with the University Hospital of Heidelberg, the University Hospital of Coimbra, also Riga, and also Naples, which is an important number, considering that you have only been those 2 years, in the portfolio. So let's go from, to the beginning of our story. You came, you met me, and you told me, Montse, this is very needed, because you cannot imagine how many, how many archetypes and how many archetypes the people have, the user, the patient have of what the radiologist is doing, when in fact, technologies are converging. The imaging is starting to interfere in many other places of the hospital, many more from before. And when I asked you, and are you early adopters? And that moment you said, well, we are, but we want to cover a gap. We want to cover a gap for this to be systemic. Can you explain me your side of the story? Because I live it like that, but I want to hear about yours.
Yeah, well, Monse, that's the true, and that's a reality. If we move to the next slide and the images, you will understand that from the evolutionary perspective of medical imaging, we had 10 years ago just a patient and a clinical need. Then we decide what was the best medical image to have and to perform. And then we, as imaging experts, we decide to qualitative make an interpretation, a report of what are the findings. But in the last few years, there was a growing of new technology and new roles that impacting directly to the pathway of medical data and medical data imaging. And first, we can talk about outcomes. Now the report is part of the outcome, but it's not the last one. We have virtual imaging, we have printing imaging that should be used to training new professionals, but also to train specialists in difficult cases. We have also the AI applied to the digital image, and we could improve the results of the diagnosis of radiologists, but also from cardiologists, gynecologists, and all the specialists that use image. And we can use AI to improve the results. And then we can use the data of the image, not just as a qualitative interpretation of the results, but also we can use this data to mix with the rest of omics and to understand better. And the second part is that we have new roles. We have engineers, bioengineers, mathematicians, programmers that are using this data and help to improve and to have new outcomes and new results. That's why it's a profession that is absolutely changing in the last years. And if we recognize that we are in the front of the testing of new technologies, and this is an example of how we apply 3D image, not just for plan, but also inside the surgical theater to understand if the changes that, and if the procedure of the surgeon is taking well or not, and to send the information during the surgical planning in order to improve and to modify the surgery. And these are examples, but also we are just testing, for example, new apps like this, the application of AI in the emergency area in order to be faster in the diagnosis of pathologies of children before and do not waiting time to the reading of a radiologist. And these are two examples of evolving in imaging, and we want to expand these technologies around and in the rest of hospitals. That's why we decide to start the course.
Well, and just to add to what you said, clearly explained that was our situation, but the reality is, okay, given that, how we close this gap between the early adopters of these technologies to really become technologies integrated in the clinical flow and to impact the patient and benefit the patient with better outcomes. And here there's many questions that arise. First, how we move from diagnosis to treatment to the whole clinical pathway. And second, how we involve all the stakeholders and the decision takers to make it happen. And third, what would be the best business model to implement these new ways of treatment? So that was the setting point for our course.
Yeah, I remember well when we discussed on who should be involved, and that's also in terms of the learner, who should be the learner, because it's not only about one specialist, it's about several people, because it's about changing processes, it's about changing the way we have been doing things for a long time, and that's meaning multidisciplinarity. But also, as you said, and that's also one of the questions that probably your learners have been raising is like, how can I make of this the strategy in my place? How can I make things happen in my place? I would like to go to the solution, because we were discussing about the gap. You know, we were discussing about, well, from the early adoption to becoming something that is an everyday practice at the hospital level. So can you explain us a bit more on how your solution is built? And then also I would like you to share with us how you make your students go wild, because anytime that you're learning about technology, technology is super powerful. It's like changing, you know, pieces here and there, but the main importance is building competence to make that applicability go farther. So let us know how you make your learners dream by themselves.
Good. So yeah, that was the objective. So we think that to close this gap and make it happen, it's with knowledge and training. That's one of the steps that we have to take, and that's why we created this Expert 3D course. And because we have universities and people working on that, but we wanted to put on the front field the vision of a hospital that have the needs and that is feeling this change. And that's why we created this project that also focuses on creating and training the professionals of the future, that surely would be not only clinicians and radiologists, but also engineers that will have to work together with all these technologies. So that's why we created this training program that it's called Expert 3D, and that it's focused on the development of knowledge and skills in image processing, 3D printing, and AI, really needs driven. So we try to make the students learn by doing real clinical cases from day one in multidisciplinary teams, mimicking the real situation that they will find in a real clinical setting. That was the main objective.
and following this objective of real transfer of skills, we decided to design a different pathway of learning. In fact, this is not about a silo of anatomy or a silo of a surgical procedure. We identify that the real hospital and healthcare pathway that starts with a clinical need, and also recognizing what are the new techniques, then moving to what is the best, in fact, technology to acquire, in this case, the image, move to the next step and segment them, post-process the image, and then decide what you want to do. If you need a virtual planning of a live or surgery, you need to test and to be able to post-process the image. But maybe you want to print and to train in a simulation scenario with surgeons or gynecologists or cardiologists. Then you need to have this knowledge of printers and materials. But then you need to move to the next step. And the next step is, can I have some features, some data from this image that I segment 1 week ago, 1 day ago? And yes, this is the next step, how to program, how to have few skills and in programming to understand that we can extract information from image. And from this pathway, we design our solution. And this is our 2020 solution. It was a 8 weeks transversal blended training program with a 1 week of hands-on direct exercises, but also with a 6 weeks of theoretical and cases or online cases before. Then what are the students? 1/3. 1/3 were from the clinical and surgical area. 1/3 were specialists in imaging, not just radiologists. We have also radiographers and other specialists. And then 1/3 were engineers or bioengineers. And what were the sites? We start with Barcelona and Coimbra, and this year, as you said, Monse, we add Coimbra, we add Riga, Heidelberg, and Napoli Segundo in Naples, in order to have a different hospitals and types of hospitals. One's third level, others not specialized in one in oncology, others in surgical, others in AI. So the idea is to have a whole spectra of hospitals around Europe.
And mentioning this going wild, which is something that we've been talking and we like a lot to send this message to the students also, and having. So we have students from, as Josep mentioned, from different nationalities. In fact, we have more than 15 different nationalities and from different professional backgrounds. And that makes that when you put all this gray matter together to work, magic happens. And some of the examples that we have, it's this, for example, it's real cases that we have in the course of students during the course that they work together to do a real clinical planning of a maxillofacial surgery, an oncological surgery, or a neurosurgery. But also, when you go and let them fly after the course and we follow them, what we find is that they are implementing this knowledge in their really real life in their hospitals. And for example, here we have 3 really nice cases that we love, which first would be Uruguay hospital that is implementing 3D printing for a surgery, real surgeries in their setting, or traumatological surgeon that is working to create new tools to help on their surgery, or in Israel that we have Dr. Kandan Makeda, who is using AI to classify and help the workflow of radiology and imaging. So that's how we measure and the impact of this. So not only with the amount of students that we train, but how they implemented that and what's the impact that it had for clinical outcomes and students and patients. And yeah, so that's basically the way we try to measure it.
Because in fact, now this was one of my questions, how you measure success and how you ambition success, and also the power of the community once the people has been trained. And indeed, community learning is a key aspect to continue learning, also to expose yourself, to learn from others. And that's one of the questions. I would like you, if possible, if you could highlight a couple of stories. You were mentioning very briefly about Uruguay or about another country. Please feel free to highlight a couple of stories that can showcase also the health outcome. It's not only on the beautiful technology that they are applying, which is indeed its beauty, but the outcome, the resulting impact that has at the societal level. So if you could showcase a couple of alumni stories.
We could talk about, for example, those from Uruguay. Doctora Silvina Zavala is a radiologist, extremely interested in how to apply 3D technology in a pediatric hospital in Uruguay. In fact, the main pediatric hospital in Uruguay, and she comes last year in Barcelona, and she was a student. And the most amazing was that 1 month after she returns to the hospital, she and their team that she built around her send us the example of the first case made by them. This is this case that you can see here. This is a maxillary tumor, and the idea is that how a third level hospital in a developing country could implement technology and benefit patients. And this is an example. In some kind of hospitals, the third level means that they are the referral from the most difficult cases. And we know that the most difficult cases need to be treated with a personalized tools. And this is the example. In fact, this was the first one, but 1 year ago, every month they sent to us the example of complexes, surgeries that they plan every month and every week using their knowledge. And just add something. We are talking about 3D, but if we focus also in AI, they are also leading a new project in LATAM in order to have a data bank of difficult cases in all Latin America. So thanks to this, they are also evolving to be leaders in how to adopt technology and how to explain to the others how to adopt this technology. So the idea is that we think that thanks to the expert 3D, they just not just know how to apply, they understand the importance to close the gap between early adopters and how to convince the hospitals and the managers of the hospitals on how to apply. And they are just also spreading this idea in the area. That's why we are happy of that.
That's exactly what I meant, because collecting cases, it's in fact a way to spread knowledge, an incredibly good one, and especially when it's based on, on real world data in these cases, because it's an extremely good practice. However, you need to start thinking as a learning organization, to be able also to make that exercise. And not all health systems have the ability yet to be a learning organization, at least, from my perspective. It's an extremely powerful example. Thank you about that. I think it looks like success also when I'm thinking about patient, and indeed there are also privacy matters that do not allow to follow certain details, but I also wonder on our role as EIT Health on how we can also keep the contact with all these alumni, in also to measure the impact and the value behind our training courses. If one of your learners in just 1 minute, 1.5 minutes, comes as Silvina did and asks you, hey, I want to make of this something relevant for my institution, what would be your advice? What are you telling them as an advice to go and to call the hierarchy and say, hey, this matters because this can change people's lives and this is important?
Good question. I'd say that it would be start small and scale fast, which is something that we know from innovation in general, but in that case, that would be clearly applicable. So start with one real case that you can demonstrate the impact and the clinical outcome and benefit. And from that, and also with all the literature that is out there showing this, but also taking out all these fears that some institutions have on applying technology and seeing that it's not rocket science, it's something feasible and that they professionals can do it. These clinical champions like Silvina, I think they can make a change and make the hospital see that that's possible and that they can do it. So I would say that start with a real case and scale fast and demonstrate the clinical impact and outcome.
Was that your story, Josep?
I think that I agree 100% with Arnau. The idea is to test, and this comes from the engineer view, and we as a clinicians, me as a radiologist, need to understand better that testing, demonstrating, and then building is the way to incorporate the technology in the daily practice. So this is from that we as a clinicians we learn from engineers that test, retest, build, and this is
in fact it's about evidence. Yeah, I fully agree. We need to close now. I would like to thank you for your presence, for your advice, for all the information you've shared with us, but also to our attendees for their time and for listening. Thank you very much, and wishing you a nice EIT Health Summit Series 2020. Bye-bye.
Thank you, Montse.
Thank you. Bye.